sudden, out of nowhere, he just lost the ability to stand up.
His right arm function went away, and he couldn't stand up.
She was playing normal kid, and my husband noticed that her arm was kind of just hanging there.
I said, "Hey, buddy, can you lift your right arm?" And he goes, "I can't."
A rare illness is causing concern for parents nationwide as cases seem to be increasing and doctors still aren't sure exactly what's causing it. Good evening. Doctors confirm suspected cases of this mysterious polio-like disease are under investigation here in Louisiana.
And as Paul Murphy reports, the U.S. Centers for Disease Control is now warning about a recent spike in the disease.
The U.S. Centers for Disease Control and Prevention is reporting 127 patients are under investigation for acute flaccid myitis, or AFM. 62 cases of the rare but serious condition have now been confirmed in 22 states.
This is truly a mystery disease. We actually don't know what's causing this increase in cases. For some of the previous cases, we've identified one pathogen or another, but we have no unifying diagnosis.
LSU Health pediatric neurologist Dr. Jessica Gautreaux said while Louisiana does not yet have a confirmed case of AFM, there are some suspected cases now under investigation here. AFM suddenly affects the nervous system, specifically part of the spinal cord.
It's significant weakness. The limb loses tone, so it becomes flaccid. That's where the flaccid part comes from. And you lose your reflexes in that limb as well.
More than 90% of the confirmed cases have been in children 18 and younger, with the average age being 4 years old. Health officials admit some of the same viruses that can cause the common cold or sniffles can also, in rare cases, cause AFM. There's no known treatment, and the long-term outcomes are unknown.
Some kids appear to improve and at the end of the course have minimal deficits or no deficits, but there appears to be another end of the spectrum where kids do not appear to improve much and remain with permanent weakness in the affected limb.
Cases of AFM have been on the rise since 2014.
The best way that we know of so far to prevent this is to keep up to date on your vaccinations and then to practice good hand washing. So at least 20 seconds of scrubbing underwater with soap.
You should also seek medical attention as soon as possible if your child suddenly becomes weak in the arms or legs. Paul Murphy, Eyewitness News.
All right, Paul, the cause of most of the AFM cases is unknown. According to the CDC, some cases have been linked to the polio virus and others to West Nile virus. It's also very rare. Since they started tracking the illness in 2014, the average rate of infection is less than 1 in a million. And the infection rate does seem to fluctuate from year to year, with even-numbered years seeing a larger number of infections than odd-numbered years. In 2014, there were reports of 120 cases nationwide, then just 22 cases the following year. Infections rebounded with a sharp increase in 2016, when 149 cases were reported. And this year, there have been a total of 62 cases, with a total of 386 confirmed cases in the past 5 years.